Hello, everyone. Welcome to the town hall. My name is Harshita Ramanan, and I'm the president of Student Government Board.
Hello all, I am Morgan Pierce and I am the president of the Graduate and Professional Student Government and a third-year PhD student in the School of Arts and Sciences.
The purpose of this town hall is to answer questions about the fall term, particularly questions related to instruction, COVID testing, vaccinations, student activities, and in-person and remote learning. We've learned that providing opportunities for students to engage with administration has been effective and appreciated.
We want to let you know that this town hall is being recorded and it will be posted online. So please be mindful to engage each other with civility and respect. And now I would like to introduce Dr. Carla Panzella, our wonderful new Dean of Students.
Good evening, Pitt community. Almost 7 weeks ago, I started at Pitt as your new Dean of Students. I just wanted to take one moment to say how impressed I am with Pitt students and families. First, what a warm welcome from so many of you. Thank you. Although there are so many mixed feelings at this time, I have observed how thoughtful you all are about returning to campus this year and continuing your education. I'm so pleased to be part of your community. You're going to hear from a number of representatives from different areas of the university, answer some of the most common questions for about 15 minutes. Although there may be a lot of information shared this evening, I encourage you to listen closely as one of your questions may be answered as the panelists speak. If not, we invite you to submit questions through the Q&A. I also encourage you to reach out directly to those who may be able to best support you, including the Office of Disability Resources and Services, or Housing, or your academic advisor if your questions are not answered tonight. Ultimately, we're working hard to make you feel supported as you transition to in-person learning on September 13th. I'm happy now to introduce Dr. Elise Martin, who is the Associate Medical Director of Infection Prevention at UPMC, and who serves in the university's COVID-19 Medical Response Office. Dr. Martin.
Hi, thank you so much for having me. I'm really happy to be a part of this town hall and hopefully answer a lot of your questions as you guys are working on your transition back to the classroom, which I know we're all very excited about. As she mentioned, I'm a member of the COVID-19 Medical Response Office, and our team has really been working hard this year to focus on a couple of key areas, work specifically on contact tracing and isolation and quarantine, and also to work on testing. We've been working very closely with student health as they identify cases of COVID-19, and then our team has been working to identify who their close contacts are, provide directed information about what to do. And of course, things are a little different this year since a large proportion of our population are now vaccinated. Not everyone exposed will require quarantine, and I'm sure we'll get some more questions about that in just a little bit. We've also been working hard on testing to make sure we have good testing options for everybody who is potentially exposed to COVID-19, as well as for those who are not vaccinated, have a strategy to identify COVID cases amongst that group as we really transition back to the classroom and work really hard to try to make things as safe as possible.
Dr. Martin, it's great to work alongside of you. Hello, everyone. My name is Melissa Mcgivney. I'm a pharmacist, and I direct the Pitt COVAX Vaccination Center, and I also serve as Associate Dean and Professor within the School of Pharmacy. This year has been really incredible in stepping up. Some of you may have been a part of our mass vaccination efforts that occurred during the spring, and the 900 plus of you that were involved, thank you. You created an opportunity to vaccinate folks throughout the region. We have given nearly 22,000 doses of COVID-19 vaccine together with all of you across campus. If you've been on campus, you might see our new center. We are located at 4041 Fifth Avenue, which is really in Northern Hall. We are right across from the Starbucks, and we're open now 6 days a week for COVID-19 vaccines. What's really special is this space is yours. This is a Pitt space. When you walk in, you're going to see bright gold walls and blue, and you're going to see Rock the Panther with a mask on, of course. But you're going to know that this is Pitt. We offer all 3 COVID-19 vaccines, which is totally unique in the area. You can walk in and tell us what you want. You can walk in and say, I don't know what I want. talk to me about the differences between the vaccines. You can walk in and say, I have a family member back home that I'm worried about, and I want to know how I can talk to them. Or there's my best friend that I'm really concerned about and I want to get them vaccinated. How can I do it? And can I come? You can bring your friends, your family. You can bring the person that you live next door to. We've had many people come together, and actually we love that. We love for you to come with someone you care about, because it creates a conversation in a safe way that we can help you to answer some really hard questions. There are a few questions that we've gotten on a really regular basis. The one is, which vaccine should I get? They all work. Let me tell you, they all work. But we'll work with you personally to figure out which one is right for you, which is a beautiful opportunity that we have, we have choices. The second is for individuals that may have been vaccinated internationally. The United States, we accept the World Health Organization vaccine. So if you've gotten 2 doses of a World Health Organization approved vaccine, you are vaccinated. If you have not, if you've only gotten 1 dose, or if you haven't gotten vaccinated at all, come on in and we'll get you restarted and we'll make sure that we take care of you. If you have lost your vaccine card, that often comes up as well, and you've been vaccinated in Pennsylvania, we can help you to get a new one as well. And that goes for anyone. So Pitt employees, students, friends, family, neighbors, you name it, we can certainly do that. The other thing that we get is, what about these boosters? You all see the news just as quickly as we all do. So once boosters are approved for whichever individuals and whichever vaccine, we will have those available on campus. So we will make sure that you have access to that. And last but not least, what we are absolutely seeing is that vaccines are keeping people healthy. We are certainly seeing some breakthrough infections, but importantly, these individuals are not in the hospital, and we're not seeing the deaths amongst those that are vaccinated. We're seeing some infection. So I know we'll be talking more about that, but the vaccines work. We're here to support you, and we're here to work alongside of you. So welcome back to campus.
Hi there, I'm Dr. Lissa Weddick. I'm the medical director of the Student Health Service. And I would like to echo what has been said about the importance of getting vaccinated. And if you've not had an opportunity to do so, to strongly encourage you to do so. We at Student Health have been doing PCR testing, and that's something that we will continue to do. We are providing that for symptomatic students. And I would say that the students that we've seen, unfortunately, many of them have been vaccinated who do come back with positives, but fortunately, they are not very ill, which is a good thing. In addition, a couple of other things I just want to take an opportunity to let people know is that student health is more than just COVID, meaning that yes, we can see you, we can provide you with testing, but we also provide all kinds of other care. So please see us for management of acute and chronic conditions. We do sports medicine, women's health. We like to provide everything under the sun that we possibly can to our students. In addition, we are going to be giving flu shots, and especially this year, it is very important to get a flu shot because it's going to be difficult to differentiate between flu and COVID. We're going to be kicking off our initiative at our Healthy U Fair on September 29th at the William Pitt Student Union, and we look forward to seeing you there.
Hi, everyone. My name is Kayla Dunn. I use she, her pronouns, and I'm an assistant director in the Office of Residence Life. A few things you should know, switching gears a little bit about my department. We have 16 live-in professional staff members who have a master's degree in higher education or a related field who are in space to support our students as they reside with us on campus. That is primary, first and foremost. 177 student staff members, RAs, CAs, we call them, who are poised to be in a position of mentorship and of leadership and of support to our students. I think most importantly, what I want to convey is that our overall mission is to help students feel as though they matter and belong at Pitt. A couple of things, right? We're transitioning from a very interesting time, a very difficult time back to on campus. and really wanting students to feel connected not only to the institution, but to one another. We work really hard to make Pitt, which is a big place, feel a little bit smaller. And so taking that from, our first year class down to a residence hall and then down to a floor community, and working to do that through both programmatic experiences, check-in conversations, individual relationship building, all sorts of things within the residence hall. So I think, most importantly, that mattering and belonging piece, working to build communities that are inclusive, that support academic success, and also promote the development of our students as people, as human beings in the world. So I'm excited to be here tonight, and I appreciate y'all letting me participate.
Hi, everyone. I'm Joe McCarthy. I'm a professor in chemical engineering, but for the last 4 years, I've served as the vice provost for undergraduate studies. I want to start off by just congratulating those of you that are returning. We really have an amazingly resilient group of faculty and students. We've come this far through the pandemic, and our students are graduating, our undergraduates are graduating at a higher rate than they've ever done in the history of Pitt, and are being retained, continuing on at the university at a higher rate than has ever happened in the history of Pitt. So I really applaud your resiliency, your drive, your dedication to your studies. And I'm hoping as we move further away from the shutdown that we had back in March of the 2020, that we take the lessons learned in the classroom and outside the classroom, and we emerge even stronger than ever before. From my end, I'll just reiterate that we are in fact moving to in-person classes on Monday, September 13th. There will be a small number of classes that are not going to be in person. These were petitioned over the summer as having an educational enhancement that comes from engaging remotely. There's also probably the largest group of courses that fit under that umbrella in the undergraduate space are those where language acquisition depends on seeing lip movement in order to get proper pronunciation. And the universal masking that we have in classrooms makes that very difficult. So those classes will continue to meet remotely, but the vast majority of our classes are in fact going to move to in-person engagement as of Monday, and I'm excited to see it happen. Thanks.
Hi, and I think I am the last panelist for this evening, or for the first portion at least. My name is Amanda Godley. I'm the Vice Provost for Graduate Studies, and I'm also a professor in the School of Education. I want to start off by saying it was great to meet a lot of new graduate and professional students at the Welcome Back picnic a couple weeks ago, and just really hear from students how excited you were to be back in person, both for classes, but getting a chance to meet and network with your classmates. And we're really excited that that is happening too. I also wanted to thank graduate and professional students for doing a great job uploading your proof of vaccination. I know sometimes graduate and professional students don't live on campus. They're maybe not on campus as much as undergraduates, so sometimes it can not feel as urgent. But you all stepped up and uploaded your proofs of vaccination at a really high rate. I think we're in the high 80s right now. So we're really, really happy about that. I want to say that graduate and professional programs are quite diverse, meaning particularly for this fall, there are some that just can't be remote because they require in-person clinical experiences in areas like dental medicine, education, social work, where really the training and the education you get is being face-to-face with people. For these first 2 weeks, there have been other programs that have chosen to offer remote options, but like undergrad programs, will be returning to in-person on Monday. Some Some graduate and professional students have appointments as teaching fellows or teaching assistants. And I want to be sure that students who are in that position know that when guidelines are created for instructors of classrooms, that includes you. So, for instance, if you are a TA, it would probably be a good idea to kind of plan ahead to know how you might engage students remotely if they have to quarantine, and also to make a contingent plan for yourself, just in case that happens. But everything from guidelines to safety apply to you too. And if you ever have any questions about that, just feel free to ask me or ask your department. So with that, I think I'm going to turn things back over to Harshita and Morgan for some questions.
Thank you to all the panelists for giving us your briefs on your departments. So now we would like to invite all the panelists, we would like to invite all of you guys to share your questions in the Q&A. But while we do that, Morgan, if you want to get us started with the first question.
Yeah, so I will open us up. I think this is a question we can probably direct to Elise. So a student has already asked if we could clarify about the testing being offered to students who may be symptomatic or vaccinated in the Student Health Center.
Yeah, absolutely. So when it comes to testing, there's actually a couple different types of testing that we do. The first is any symptomatic patients or any symptomatic students will get tested. And we recommend this whether or not you are someone who is vaccinated or unvaccinated. And although, of course, these infections are more common in the unvaccinated, because we have a very high rate of vaccination amongst our population, we're going to see breakthrough infections. Because although the vaccines are very effective for helping you to have poor outcomes, you still may have moments where you have a more mild infection. And we still want to identify that to decrease the risk of spread. So if you do have any symptoms, whether you are vaccinated or not, even if your symptoms are very mild and you're like, oh, maybe it's not that big of a deal, we encourage everybody to get tested. And Student Health has really great availability with really high quality tests to give you answers in real time. So definitely reach out to Student Health for any symptomatic testing needs that you guys have. Now, if you're someone who is exposed to someone with COVID, we do recommend that you get close contact testing, which means if you have been within 6 feet for 15 minutes with anybody with COVID-19, whether or not you're vaccinated, we are going to recommend testing. There's a little bit of a difference in your recommendation, though, whether you're vaccinated or not. If you are fully vaccinated, you do not need to quarantine because your risk overall of spreading the virus is very low, but there's still a risk. So it's very important to get tested 3 to 5 days after your exposure. We have a couple different options to do that. We have some on-campus testing through Student Health, but really what we're trying to encourage everyone to do is order Quest at-home testing. But if you have questions on how to do that, reach out to Student Health because they can definitely direct you on how and when to get your testing done. For those that are who are not fully vaccinated and are exposed to someone with COVID-19, in these cases, we're going to recommend that you quarantine because your risk of acquiring the virus and potentially spreading it to others are higher. And so for 14 days, we would ask that you quarantine. If you get tested during that quarantine period on day 7 or 8, we could actually potentially have you out of quarantine after day 10, which is a nice way to shorten your quarantine to get you back to the classroom when we know it's safe and you're healthy to do so. It's also important if you are exposed to someone with COVID to make sure you're wearing your mask at all times until we have all of your test results, and then Student Health determine that it's safe for you to spend time around some of your friends without your mask on, especially when you're outdoors, where it may be acceptable to do that. The other testing option we have is something called focus testing. There may be scenarios where we see a couple of cases of COVID-19 and we have a concern that a larger group may have been exposed, even though we did thorough contact tracing and didn't really find any other groups that needed to be identified, but we may offer it. So sometimes this will happen with, for those of you who were here last year, some of our dormitories where we had cases of COVID-19, we offered testing to a pretty extensive group of people because at the end of the day, our goal is to identify any cases and keep everyone as safe as possible. And so you may be contacted to, and offered focus testing, even though you weren't necessarily confirmed to be exposed to COVID-19. And those are typically right now being done through Quest at-home testing, but we may have more options in the future. And then finally, for those of you who are unvaccinated, you may be familiar with our testing strategy for Quest at-home testing for all of the unvaccinated. This is not something that our vaccinated folks need to do. This is really just for the unvaccinated. So like I said, we have 4 different types of testing, 3 of which, whether you're vaccinated or not, we do recommend. So symptomatic, close contact, or focus testing, whether or not you're vaccinated, we do recommend getting tested in those cases.
So we have 2 overlapping questions that I think would be great for anyone on the panel. One being, what happens if you do test positive for COVID? What is that protocol for going to class and quarantining, and whether or not you go to class in that? And then secondly, how, if you can't attend class, what's the protocol for individuals, and are any virtual learning options going to be available?
So I can jump in and answer the academic part, but I might ask actually that Lisa respond to how we should handle
Yeah.
the notification of student health
Right.
first.
So if somebody contacts us and is symptomatic and we offer them testing, a lot of it depends on where they live. And so students who are on campus, and it's determined, so if they're positive, they live on campus, it's determined that isolation is not safe for their cohort, then they are moved into isolation housing, and they are there for 10 days following the positive test. And housing is doing a fantastic job and taking care of everything they need. So that's really, they are very well taken care of. If it is a student who lives off campus, then that's a conversation. And so a lot of it depends on, do you have access to your own bathroom? Are you able to ensure that you're not going to be infecting your housemates? And so that's kind of a discussion. We have some students who do choose to utilize the isolation housing, even if they live off campus, just to maintain the safety of their housemates.
Thanks, Lisa. So my takeaway from that is that communication is really going to be critical. If you test positive, you absolutely need to communicate with student health services to make sure that they can do proper contact tracing and make sure that your colleagues, both in the classroom and where you live, are kept as safe as possible. Once that is out of the way, if we know that you're quarantining because someone that you've been exposed to has tested positive, or you're isolating in the isolation housing or in your own home because you personally have tested positive, we will have options for students to engage remotely in their classes to bridge the gap between when they were in person prior to their isolation or quarantine and when they're ready to come back to the classroom. As you all know, we're not going to be offering widespread, synchronous, flexible virtual learning like we have in the past. And there's a number of reasons for that. That was a very difficult position to put a lot of our faculty in order for them to be really accomplished at doing that. They did a fantastic job, as I mentioned the first time I spoke, but it's very taxing on our faculty. It splits their attention between the remote students and the in-person students, and it makes it a difficult situation for them. But those of you that do have to quarantine or isolate, there'll be options that are going to unfortunately vary by class. It's not something that we can tell you right now across the board what your actual accommodation is going to be. Because, for example, in large lecture classes, it'll be very simple for the instructors to record the class and to make those recordings available to you to watch offline. That one's very simple. If you have a small discussion-based class, though, that's going to be much more complicated. Recording a discussion doesn't allow you to engage in the discussion and really is a lower quality academic experience. So what I'm going to encourage that you do is, after you've communicated to student health services, you communicate to all of your faculty that they know that you're not going to be able to come to class in person, and then they'll be able to go to the teaching center and look at the menu of options that we've prepared, that Cynthia Golden and her team have prepared for faculty to figure out exactly what's the best pedagogical techniques to use to keep you up to speed during your time in quarantine or isolation.
And let me just add again, for graduate students who are TAs and TFs, all of that is available for you too. Cynthia Golden and the Center for Teaching and Learning's team to help you figure out how to engage students who have to be remote because they're quarantining or in isolation. All those resources are for you as well.
Thank you for those answers. We have 2 more questions that came in the chat that I also think can go hand in hand, and anyone in the panel can answer this as well. But what if a person with someone immunocompromised, what if a person lives with someone immunocompromised? Will a remote option be given, as well as for any other vulnerable individuals at home that could possibly get COVID easier than others? And then what could you expand on the DRS accommodations? Because I guess students are a little confused on what the guidelines are for this.
I can kind of hop on for a moment here because I know I've been working with DRS with some students who have requested accommodations for a variety of medical reasons. And it's not a one size fits all. And it's very individualized. So I'd encourage anybody who has concerns about their health and about potentially being immunocompromised, not feeling comfortable returning to classes for some sort of a medical condition, to reach out to the DRS folks, and then they will be able to kind of come up with what will work out best.
I would just add that for those who have challenges, and I would echo Lisa's comments about seeing DRS to see if they qualify. We do know that those who family members have the challenges and not themselves often do not qualify for the accommodations. And I would encourage students to work with their professors individually, because as Dr. McCarthy shared earlier, there are very individualized kind of components of your courses. And then I would also encourage you to email the Dean of Students if you are looking for housing accommodations because you'd like to move on to campus as a result of wanting to be in person and attending class. We do know that housing is quite full at the moment, so I don't want to make promises to students, but we do know that there are circumstances that perhaps they would be better served on campus and could accommodate students that way. And then we would encourage you to speak to your advisor about the challenges that you're experiencing and what's the best course of action for you to take because of your concerns for your family members at home related to your course schedule for this semester.
I think it'd be useful for us to kind of think a little more generally. So one of the questions that's come up many times from grad students, and I know Harshita has gotten this question from undergrads as well, is what if I don't feel comfortable going back to class? And so I am actually going to ask Kayla if you would mind jumping in, because I know from the grad student perspective, thinking about being a TA and dealing with your undergraduate students, you worry about what goes on in the residence halls, but also for our undergrad population, I'm sure we all want reassurance that they feel safe in that capacity.
Yeah, I think first, it's okay if you are feeling uncomfortable, right? I think we've all been in situations due to the pandemic where we feel uncomfortable, and we all have our own experiences and spaces that we are in that inform that, right? So I think the first thing is just to validate, like, that's okay. And I think to strive to think about what's within my locus of control and how do my behaviors affect myself and my community around me. And those are the things that we talk about with our students and residents, right? Like, of course, there are specific policies and guidelines that we need to follow, and that within the residence halls we're enforcing, specifically around, namely, face coverings within the residence halls and public spaces, and navigating just what that looks like, how we're interacting in those spaces. And then quite frankly, when folks are kind of out of our space, because that happens, right? Knowing when you come back in, right, that those actions, behaviors, decisions that folks are making directly impact the folks living within that proximity. And so I think from our standards and our kind of way that we're living that out is making sure that students are informed, right? That they know what the policies, the practices are on campus, specifically with within the residence halls, that they know the resources, that they know, and that our student staff know, hey, if someone isn't feeling well, what do? We call the student health center. We ask for help, right? If someone wants a vaccine, where can they go? If they have questions, who can they speak with, right? I think a lot of what we do is, again, educating folks on that, providing those resources, and transparently reassuring students that it's okay. You're going to be in spaces where you might not feel 100% comfortable. Where can you go to seek information, and what are your resources? I think those are the best pieces that I can provide in relation to that. But thanks for pulling me in. I appreciate it.
I'm always happy to put people on the spot. We have a couple more questions coming in about DRS, as well as if there is any plan for the Mu variant. So I will leave that one on the table for whomever wants to pick it up.
I mean, I can definitely start with some of the discussion about variants. So we're constantly looking at cases we have on campus and cases that we're having locally to see what variants we're experiencing, and then working pretty closely with our local health department, with our local hospitals within the area, as well as our national guidelines from the CDC and from the Infectious Disease Society of America to track what are the recommendations for each of the variants. Right now, we don't have anything specific to do for Mu, but if anything does come up, we are definitely going to be on that and providing information to you, all of you, through regular CMRO updates, and let you know if there's going to be anything to do differently. Now, although new variants are always going to be emerging, Delta is here with us, and we do know that the Delta variant is pretty significant. It's something that it can be highly contagious, and so a lot of the mitigation that we've been recommending over the last year is still essential. And I think reminding everyone that masking and social distancing can be really, really effective to help keep everybody safe. And so if we do get new guidance based on new variants, we will absolutely share that information as soon as we have it with all of you.
I think there was also questions regarding if graduate students will be approaching DRS the same way as undergraduate students, and if there is a delay with that process at the moment, because it is anticipated that DRS is probably getting a lot of requests at this time.
I know that Lee Cully, who is director of that office, answered the question in writing, but I will also kind of paraphrase here. Yes, graduate students should follow the same process as undergraduates when contacting DRS. And it doesn't sound like there's a particular delay right now. From what I understand, that DRS has not been overwhelmed with requests.
And then we have another question about vaccinated individuals and whether they will be receiving any mandatory testing.
So at this time, the only mandatory testing that we have actively on campus is for those who are unvaccinated as part of our weekly testing strategy. So for those of you who are unvaccinated or have not uploaded vaccine cards, you've probably already started to get emails, and many of you have already started getting your test kits and sent them in. We are actually starting to get some of those results. For those of you who are vaccinated, the one time you do need to get tested though is if you're having symptoms. So if you have symptoms, please, please, please reach out to Student Health Services, get tested, get checked out, because we certainly don't want to have any additional spread on campus.
As a quick follow-up to that, we have another question in the Q&A that I think is relevant about will weekly surveillance testing and vaccination rates continue to be released, and on what kind of schedule?
So the CMRO is working on our information that we'll be putting out. We'll be putting out our second CMRO update relatively shortly. So you guys should be seeing that soon. And it will provide some of the information about positive cases, about our vaccine numbers, and some of that information will be available. So more to come.
We have two kind of hard questions in the chat that, or in the Q&A that the first one I'm going to read because I think it's important. The student says, I don't understand why flexible options are not being offered, especially at the graduate level, for at least the fall semester. They have a young child who's not eligible for vaccine, and the flexible options we've had for the first 2 weeks make them feel more comfortable. And then secondly, someone has asked why there are no social distance requirements currently indoors. So perhaps Dr. Godley, Dr. McCarthy, if either of you could address those, I think that would be helpful to our attendees.
I can address the first question, and that is really to say we would not be having classes in person if we didn't think it was safe. If the CMRO hadn't looked through all available data and studies and information that we have on transmission and let us know that people being in person is, of course, we can't say, 100% no transmission will occur, but the decision was made based on a lot of careful information and discussion about what was in the best interest of students.
And I think one of the things that's really incredible about our campus is really the high rate of vaccinations that we're continuing to see. That is a really important part of being safe for yourself and for your loved ones. Your ability to be vaccinated, to stay masked, really does protect those around you. And that has really been an important part of the decision making at the university level as well.
Okay, thank you. Another question that popped up is anything being done about big parties and super spreader events?
I'll take that one, Harshita. Thank you. A couple of things I want to say about that. One is that we have seen students gather outdoors, so we want to acknowledge that. Both in sanctioned events on campus, but also we have seen off-campus events like that, and we have not seen a spike or an increase in positive cases as a result of those gatherings. And I think I will echo Melissa's thoughts on that's because most of our students are vaccinated, and I will continue to ask those who are not to consider it. And if you are, please upload so that we have that information available and you don't have to test. I would say that I will take the opportunity to share that we want students to be good neighbors. And that is something that we are thinking about when we think about large scale events off and on campus. Dr. Bonner, myself, and some other folks did some Oakland walks last week where we went through the neighborhoods and handed out some Pitt swag, as well as information about health ways to stay healthy and how to be a good neighbor. And we want you to consider both of those, particularly if you're off campus and you are making decisions for yourself, your housemate, and those that you live around. Really consider your behavior and what you do and how it impacts your community. And so we have seen a lot of positive behavior from our students and a lot of responsible behavior. So I want to be fair to the majority of our students and really give them a lot of credit and appreciation for their cooperation and consideration there. But we do want students to think about their actions and how they impact others. We are very happy to say that our vaccine rate is high, and therefore we have not seen the super spreader events that that we've seen in the past at other institutions, right?
going to jump in if I can. I think one of the things and what you were speaking to, Dean Panzella, is a hunger for students to be connected again, right? And I think that that's something that I named in my introduction. And so just speaking not only for the Office of Residence Life, but I also serve on our Student Affairs Programmers team, to name that we are actively thinking about ways that we can proactively provide that space for students in a way that is safe and responsible, to be able to connect mostly outdoors right now while the weather's nice, right? But thinking about all of the aspects of our programming in a way that's accessible to students, and again, that is safe and comfortable. And so really wanting to bring folks together again, to connect them to one another, to the institution, in ways that are super positive, especially as we're kind of coming back to it, right? So I just wanted to interject there a little bit as well.
Thank you. I think the next question, probably Dr. Weddick can answer it. But when including our vaccination numbers in the decision to prohibit flexible learning options, were the risks of long-term COVID effects considered? Sorry, words are not coming out of my mouth today.
Wait, I'm sorry. If you can, what was the gist of it?
Were the long-term effects of COVID considered for the decisions that were made for in-person learning?
I mean, I will be quite honest, I was not part of those conversations. And so my understanding is that the people that were part of those conversations were looking at, vaccination rates, looking at kind of weighing all of the risks versus the benefits, and coming up with what seemed like the best way ahead for our students to be able to get a robust education.
Sort of along those lines, I think there's also another question regarding vaccinations and COVID specifically. So although a lot of our students are vaccinated, how are the realities of vaccinations and cases in the county as a whole being accounted for, considering Pitt is an integrated urban campus?
I mean, I think we're just working pretty closely with the Allegheny County Health Department. Allegheny County, by and large, also has a pretty high vaccination rate. And the thing that is sort of almost paradoxical is that the higher the vaccination rate is, it's almost like when you see these breakthrough infections, you're going, wow, the vaccine, wait, what's the matter? But it's just because we've got such a high vaccination rate that it's pretty much inevitable that you're going to see some breakthrough infection. And really, the intent of the vaccines was to protect against severe disease, not to protect against all disease. So albeit, that we're seeing a lot of pretty mild cases.
And I think, as you say that, Dr. Weddick, it's reassuring in one sense. I know the students are also feeling, oh my goodness, I could still get infected. But the reality is, where we are seeing those breakthrough infections, it is mild. And that's very, very different than where we were in the spring, where it wasn't, if you're unvaccinated, it's not mild, and it can be very different from one individual to the next. So we're still seeing the mitigation measures, and I think that that's a point of confusion. I'm vaccinated and I still have to wear my mask. But that is true because not every person is vaccinated, and we do not want to continue to spread. So those mitigation measures in the classroom are really important. And I hope that you find that when you are in the classroom, there's an incredible richness of that interaction and that safety of being around others. And so your actions outside the classroom influence what can happen inside the classroom. And I think it's a reminder we're all a lot more connected than maybe we sometimes think, but I think that that's really special. So that the vaccines are doing what they're supposed to be doing, and we will still continue to see some of these breakthrough infections mild, which is good.
And as she mentioned, there's sort of multiple layers to the infection prevention strategy. I mean, one part of it is getting as many people vaccinated so they have a low risk for having severe disease. The next part is some of the mitigations, so specifically looking at masking. And that's part of why we never removed masking on campus. We really said that making sure we stayed healthy was a priority throughout the entire last year. So I think combining those two pieces is really important. And then the added piece is potentially social distancing. So when you're thinking about where you want to sit in class, where do you want to be, Sometimes adding in that social distancing component can actually make it even safer for you to be in class. So I think we have a lot of potential strategies. There may be even options to have different personal protective equipment or different masks. And certainly talking to student health can be ways to have those conversations about what are some good options I can use to help keep myself safe. And I know they've already done that for a lot of students. It's been really, really helpful.
So I think our next question should probably go to Joe. And it is, the person said, I've seen a disconnect on social media that students are hearing from faculty that they cannot accommodate students without DRS accommodation. Could you maybe address that?
Sure, thanks, Morgan. So again, we have to recognize that all classes are going to be different, right? Pitt has a rich diversity of subject matter, from lecture-based classes to discussion to service learning to lab courses. So what I say on this point isn't universal, right? It's going to have to be tailored on a course-by-course basis. But the bottom line is we are not restricting faculty from being somewhat flexible with students. What we're restricting faculty from doing is harming the in-person experience for the students that are in the classroom, right? So again, if we take the example of large lecture classes, there's no harm for those faculty to record their lectures and make those available for students. In fact, that's beneficial, right? Even the students that are in the classroom will benefit from having those classes recorded because they can go back and review the lectures that they've already experienced, right? But if you take that same large lecture classroom and we put the laptop in front of the instructor and they're peering at the chat to see if there are questions, and they're trying to teach to both their laptop and the 200 students in their classroom at the same time, that decreases the experience for all the students involved. So that the former, where we're recording lectures so that students can engage with them offline, is by no means restricted to only cases where DRS has mandated that that we make an accommodation for students. But that latter is something that we want to avoid, even in the case where there are DRS accommodations being made, right? That is not a reasonable accommodation for that individual student, because it actually detracts from the entire learning environment. So in each case, we have to treat things a little bit differently, but really the litmus test is going to be, have we enhanced the learning experience for all students, or have we detracted from that learning experience?
Okay, thank you. Just a quick reminder for everyone to type their chats in the Q&A just to ensure that your questions don't get lost. But on that note, there's a few questions about social distancing. So if someone would be able to address how it would be possible to social distance in a bigger lecture room, and also, does social distancing matter?
So social distancing is one of the many things we can do to help reduce the risk of spreading COVID. Obviously, masking, I would say, of all the choices, is probably the one that's most effective. We know there are great results from a number of studies that show if both people are masked, the risk of spreading COVID is very low. The social distancing adds an extra element. It's harder to spread it over further distances within the same space. Now, for those who need to figure out how to do that effectively, take note of the space you're in. It's hard for me to say something very general because every class is a little bit different. Do we have different sizes? If your chairs are movable, can you move the chairs around so you're a little bit more spread out? All of those things can absolutely help. And if you do have specific questions on how to do it in your individual classroom, talk to your professors. They certainly want you to be staying as safe as possible as well. They want you to have a great academic experience. And so, is there an opportunity to move things around a little bit in the room? Can you sit further away? Can you sit in the back? Are there potential ways that we can find a space where you are at the lowest risk of contracting COVID? And certainly that is absolutely our priority, to make a great academic experience and prevent any additional spread. And I think there may be some questions as to why we had moved away from a social distancing requirement from last year. Last year, spacing everyone apart 6 feet wasn't always feasible for a lot of the stuff that we need to do at the university. Part of that is having people in the classroom, and part of it is research. It's really hard to do experiments and things like that, or to train others when we have a requirement to social distance. And so we really try to focus on one key element of mitigation, masking, and allow for opportunity for people to do a lot of the great stuff and the great work that gets done at our university and have everyone be very successful.
I just want to ask for a quick clarification. We are requiring masks in the classroom, but social distancing is not required. It's at the discretion of the instructor. Is that correct?
I mean, when it's feasible to social distance, we still recommend doing it. So if your space allows you to social distance, absolutely, you should be doing that. But it's not a requirement. Masking, though, is a requirement, because we really do need to have a really good option to keep people as safe as possible. But certainly there are ways to social distance otherwise, and really be looking into those when you guys think about where you're going to be in classrooms or in other spaces.
So Morgan, if I could just add to that a little bit. So obviously we do have some classrooms that are quite large, where it's just physically impossible for us to social distance, right? If we have 250 students in a lecture hall that holds 250 students, there's not going to be the opportunity to social distance. In those instances, we really need to lean on masking. You can certainly upgrade your mask to an N95 mask. That will dramatically reduce the likelihood of infection while you're masked. But more importantly, we want to avoid eating and drinking in classrooms, because that requires that you're taking your mask off, and that's going to be very risky behavior. So certainly in those large lecture classrooms, we want students to stay away from situations where they need to remove their mask, even for a short period of time.
Thank you. Would someone be able to answer why vaccines are mandated? Perhaps Dr. Martin?
Dr. Mcgivney, do you want to handle the questions on vaccine? You're certainly our vaccine expert.
That tough part is, the decision about vaccine mandate is far greater than the group that we have here. But the one thing that I'll share with you is when you look at the expectations of universities across the nation, the mandate that you might see, it says get vaccinated. And if you can't, here are accommodations if there's some reason you don't want to get vaccinated. You look at the recommendations that we have as a university, the chancellor has come out and said he expects us to be vaccinated and also provides accommodations for those that have a strong reason why they may not want to. So the language and the policy that we have looks very similar to what you're seeing in a mandate situation. You're just not seeing, the word mandate, but the expectation here at the university is that everyone is vaccinated. If they are able, and if they have questions, come talk to us. We are more than happy to have those conversations with you, your loved ones, talk to folks over the phone, put you in a position to be the most confident you can and able to receive a vaccination and support you through that whole process.
As a follow-up to that, I think this is also relevant. Someone asked, how are we sure about the true rates of COVID on campus if surveillance testing is only for unvaccinated individuals?
So I can take that question. And just to piggyback something off of what Dr. Mcgivney just mentioned is our mask, although we don't have we don't have a vaccine mandate on campus, just getting the message out, the outreach that her team from the Pitt COVAX group has really done has been highly, highly successful. And we actually have an extremely high vaccination rate on campus by students, faculty, and staff. And so I think that is something that, although we don't have a mandate, it's been highly successful to work from the angle of answering your questions, trying to get you on board with getting vaccinated. And I think for a lot of people, that approach has been really, really successful. So as for questions specifically about testing, most places don't do routine testing of every single person every week. It's pretty cumbersome to do. And certainly the more challenges we pose to make getting testing available to everyone doesn't always lead to the best results. And so we really want to focus on testing where we think it's going to be of the highest yield, We're obviously testing people who are symptomatic, testing everybody who's a close contact, and then testing groups of people around cases that we have through focused testing is a lot more effective than just sort of blanket testing everyone every week. Now, for the unvaccinated, because they have a much higher risk of contracting COVID, that is where we think using the resources is highly effective to get testing every week in those individuals to really make sure that we help to identify any additional cases on campus. Our goal with our testing strategy is not really to do a specific count of how much COVID is on campus at any given moment, but to really focus on cases of COVID where we can identify them and get things targeted and get people into treatment and isolation and quarantine as needed.
And I think it's important to remember as we're going into the fall season that those symptoms, the reason it's so important to get checked is because it may not be COVID. We are seeing RSV infections, flu season's coming up. Please get your flu vaccine, come see us. But it's the symptoms are so similar amongst different viral infections that it can become really confusing. And so making sure you're taking the time to go to student health, to get checked, to find out what it is, because the recommendation for how you care for yourself and those around you becomes different depending on the virus that you're infected with. Good news is masks keep a lot of viruses away. So masks are good for lots of good reasons.
Thank you. So our next question is, under the current flex system, even with the return to in-person, there's a number of my classes that have over a third of students attending remotely, some up to 50% of the students attending remotely. How are these students' preferences and needs being addressed? Perhaps Vice Provost Mccarthy or Vice Provost Godley can answer that.
I can start off addressing that. So I think that from what I've heard from students, both graduate and undergraduate, during these 2 weeks, not necessarily going to the classroom doesn't mean that the student doesn't want to be in person. Maybe that was too many dozens in a row. A lot of the students I'm talking to have chosen not to go to the classroom because the faculty isn't there. And they're eager for the day when the faculty will be back in the classroom, the instructor, and so they can return to learning in person. So I think from what I've heard from students, it seems like even if they're choosing a remote option now, it's not because they want to stay that way.
We have another question about from a student who is an undergrad working at Presby. And they say, I regularly interact with COVID patients. Will professors be required to offer hybrid/online options for students who are exposed? I think that in answering this question, it would be really helpful to have the perspective of a faculty member. So perhaps Dr. Godley or Dr. McCarthy, thinking about how faculty members feel and what that kind of work takes at the end of the day.
The one thing I am going to add is that even with an exposure, if a student is fully vaccinated, then quarantine is not warranted. Just to make sure that that's clear. So testing, but not quarantine.
That's really helpful.
Yeah, so I'll take that one since Amanda took the last academic question. But it is really critical what Lisa just mentioned, that just because you're working with COVID patients, if you're personally vaccinated and you're not symptomatic, then you work with student health services. But if they tell you that you don't need to quarantine, then we don't need to worry about what accommodations faculty might give you. However, if you do become symptomatic or you do test and need to isolate and you need to quarantine or isolate, then absolutely faculty will be working with you on a case-by-case basis, depending on the type of course, in order to allow you to continue your studies during that 10 to 14 days, depending on what your status is and whether or not it's an isolation or a quarantine. To Morgan's point of what that might look like, We've already talked about the large lecture classes, so let's talk a minute about what might happen in a discussion-based class. In a discussion-based class, it's really important that there's synchronous interaction between you and your instructor and your classmates. And so one example of what we're piloting, and the teaching center is working on this with some student workers. If, for example, you happen to need a sign language interpreter, what would happen, you would go to the classroom along with an interpreter colleague that would actually be your intermediary in that discussion between those in the classroom and you. We think of allowing an accommodation for quarantining or isolating students. It's very similar, except instead of an interpreter, you would wind up having essentially a Zoom avatar, right? So someone would actually come with their laptop. They'd be able to point their camera at your classmates. And while the other classmates and the instructor don't need to be looking at Zoom, that would be the point of the student worker that goes to your class for you, right? So if you have a question and want to contribute to the discussion, that colleague, that student worker that goes to the classroom for you can actually be that intermediary and can ask your question or bring up the points that you brought up. So that's the way that we can try and accomplish the same objective, having you engaged in that discussion class without overburdening the faculty or reducing the quality of the learning experience for the others in that class.
I want to jump in and just kind of continue this thread for a moment. So we got a question of vaccinated individuals, if positive, aren't required to quarantine. So I wanted to direct that, I think, probably to Dr. Weddick. And if I may, my understanding is if you're positive, you do have to quarantine. If you're vaccinated and you come in contact with someone.
So it's like the key distinction between isolation and quarantine. So we isolate the sick, we isolate the positives, we quarantine the exposed. But if you are fully vaccinated and exposed but have no symptoms, you don't need to quarantine. Does that make sense?
That does to me, and I think it answers the student's question.
Okay, good.
Okay, jumping in for the next two questions, I think they kind of go hand in hand. So the student asked that I think that the concern with breakthrough infections, particularly with graduate students or staff, is with the potential of long-term effects and risk of spreading it to at-risk family members. Can someone please speak on long-term effects following mild COVID in vaccinated individuals? And then the following question, I think, also goes with the first question, which is, this student goes home to their elderly grandmother every day after school, and what's stopping them from transmitting the virus over the course of the entire semester to their households?
So I can perhaps start part of that, and Dr. Martin or Dr. Weddick, maybe you can jump in for the second part. The question with regard to exposing family members is such a precious one. I mean, it's very real for so many people, and that family member could be, in this case, a grandmother, but it could also be someone that you live with in any capacity. What we know is both individuals being vaccinated is really important. And so that's number one. When two individuals who are vaccinated are living together, their risk of transmission decreases. The second is that when you are on campus, we're asking and expecting every single person to mask. That is the second thing that you can do. So being masked and limiting the amount of exposure that you're having, not only on our campus, but in other aspects of your life that you're masked, those are things that can protect that individual who you care for and live with at home. And Dr. Martin and Dr. Weddick may add some addition to that, but starting with getting everybody vaccinated is really important. And then you can perhaps speak to, we're continuing to learn about breakthrough cases and what those effects are long term. And I'll pass that baton over to you, Dr. Martin.
Yeah, I think you already kind of hit the nail on the head on this one, which is we still are learning a lot about the virus. And so the overall long-term effects are something we're definitely still researching at this time. But it looks like in general, if you were fully vaccinated, your risk of getting COVID or having significant like severe disease are relatively low. And so I think that that is something that I think definitely gives me a lot of encouragement. But I think the most important thing when you're thinking about potentially whether you could contract COVID, whether you would get sick, using all these other tools we have for mitigation, particularly masking, being thoughtful about social gatherings, all of those can absolutely help keep you very well protected. And I think those are important things to be keeping in mind as you try to navigate your risk.
So we have just a few more questions left in the chat. I don't know if we'll get through all of them as we're getting close to the end of the webinar session. But I did want to ask this one. A student asked if a study had been done on student preference to be in the classroom or to be remote, or if that's something that we have been taking anecdotally or just observationally.
At the graduate and professional level, over this summer, when schools had the option to request that courses be remote, one of the things that they were asked to give as a potential reason is that students had requested that. And more, it was based on requesting it for reasons of engagement. So at the graduate and professional level, we have people who commute great distances, folks who work all day, and so find it actually easier to engage online rather than drive to campus. And so that was something we asked each school to provide to us. So, I consider that more than anecdotal, but, did we do a survey and ask every student to respond? We didn't. And I think I would say part of the reason is that the landscape was constantly shifting. And sometimes what students preferred 2 weeks ago was different than what they would prefer at a particular later point in time. And that's something that we found in the spring as well.
So I want to just ask if there are closing thoughts that any of our panelists would like to speak on, any concerns that they may have heard from students that haven't come up yet tonight, or any thoughts that you want to leave us with.
I do want to share, and you're going to think vaccine, but I think you should be very proud to be a part of this university. The thoughtful approach that has been taken on every level, including the students. You've made choices. You've made choices to get vaccinated. You've made choices to keep yourself and your people you care about safe. And as I get the opportunity, and I'm sure many people on this panel, talk to others across the nation and talk to other universities, I continue to be so proud of our students and the work that we do here at Pitt. We will continue to navigate this with you. This is new to everyone. And so listening to you, listening to sessions like this, listening to your questions is really an important part of us growing and moving through this pandemic together. So thank you for taking the time with us tonight.
Harshita, can I just add one last bit that I want to acknowledge that this transition back to in-person is not easy for everyone, and that there might be some anxiety and stress related to that. For some, it's just the routine of it. Some of them, there's fear related to it, and health concerns. There's lots of reasons why there's stress and anxiety around this transition. So I want to acknowledge it, but I want to also offer resources on our campus. We have the University Counseling Center available, and there are multiple opportunities within that center that can help you speak with somebody, and be together with others on this so that you do not have to be alone in the stress and any of your anxiety. So you're not alone in this. And I wanted to just add that as a component, because I think it's really important that students acknowledge that it is going to be a bit stressful, but you're not alone in that.
Okay, thank you everyone for making time to be here with us today, and thank you to all the panelists for answering all these awesome questions. I just want to say that as concerns do come up throughout the year, don't hesitate to contact any of us, Morgan and myself included in this, but there's also the Pitt Concern Connection. So I'm just going to put a little plug into that. So if concerns do come up throughout the year, just look that up and you guys can add your concerns through that and it will get to the right person and your questions will be answered as well. So thank you everyone and have a good night.